Welcome, everyone, to another edition of SCRC's Let's Talk Caregiving. I'm your host, Roberto Velasquez, President and CEO of Southern Caregiver Resource Center, and I'm here as always with my co-host, Marta Rañón, our Executive Vice President. How are you doing today, Marta?
I'm doing great, Roberto. Happy to be here.
Fantastic. Me too. Today's special guest is Junie Baratti from A Caring Touch Home Care. Junie joined A Caring Touch Home Care in 2022 as Director of Operations. Junie has over 35 years in the senior care space with experience as an executive team member, consultant, and former business owner, successfully piloting innovative ideas and novel approaches in senior care management. Welcome, Junie, to SCRC's Let's Talk Caregiving podcast today.
Thank you for having me. It's a pleasure.
Junie, I am so glad that you're here with us to talk about something that is of so much ordeal sometimes for family caregivers is when they come to that realization that they need additional support in the home. And I am glad that you have that experience and that perspective to really help caregivers identify when it's time to bring somebody into the home and then how would it go about doing that. So maybe you can tell us a little bit about the work that you do, Junie.
So it's always hard to bring somebody new into your home. It's not just hard for the care receiver, but also for the caregiver to bring somebody new into the home. But it's really vital. It's vital for the caregiver to get the help that they need. I myself was a caregiver for my grandfather and grandmother, and it was my grandfather had dementia, and it was scary to leave him alone. And it took a while for me to recognize the fact that I couldn't leave him. He would turn the knobs on our gas stove on. I was always afraid of a fire. It was just running to the store was so much worry. So you need to be able to go to the dentist. You need to be able to go to the grocery store. You need to be able to do the things without the worry. And that's where you bring in a respite worker to the home who is trained in dementia, and every household is different. So, what we would do is once we receive the fact that you need some help, we would reach out to the caregiver and we would ask them, what are the triggers? What can we do to make this transition better? And get that feedback from them. We would then let our client care coordinators know, let the caregiver that we choose know.
I'm glad that you take that input into consideration because obviously it's not just the care receiver, but it's really the whole unit, right? The family, the individual who's the caregiver. In this case, the professional caregivers, right? The people that you have on staff at our Caring Touch to help the families. What is one of the challenges that you see with people get to the point that they finally need care and additional assistance? What is it that's preventing them from making this decision earlier?
I think it's guilt
Mm.
that they don't, they, that I think it's guilt. They feel like they
Mhm.
have to do it all. And you can't, I mean, everybody needs help. They need to get that help for themselves. In order to be a better, caregiver, you need to have that respite. You need to have that. And I know I felt like I could do it all. And I know that feeling, but you really need to be able to feel that you can leave the house and safely leave somebody and know that the house will still be standing. For me, it was, will my house still be standing?
Junie, I appreciate you saying that. I know guilt is definitely a big factor in allowing others to us to help. But I think one of the other things is finally accepting the idea that you can't do it all by yourself. Like you were saying, you were a caregiver, you were afraid to leave your loved one by yourself, by themselves, but you also were afraid to that something was going to happen while you're not there. And that's always a big concern for family caregivers. I know at Southern Caregiver Resource Center, we often have family that, could really benefit from respite. They are so overwhelmed. They've been providing care for several years with very, very little help in the home, even if they have close family, because it's very difficult to go, especially when somebody has Alzheimer's and behavioral problems, to go in and stay for a while with them without somebody else with you, you know? So it is very, very challenging, and there's a lot of apprehension. And we have many families who could benefit, and they accept, in theory, the break, the respite, but then it takes them a lot of coaxing from our family consultants, or from an agency like yours with your coordinators, to encourage them to receive that help and let somebody in, because of that guilt that comes along with the caregiving.
Junie, I'm wondering if, since you do see a lot of this hesitation from families before they contact you, what are some ways that they can maybe plan or prepare to work with, either respite providers or home care agencies to welcome the additional help?
Definitely give us all the information on the individual we're caring for. We need to know favorite foods, where photo albums are, how to de-escalate a situation, what they like, what fabrics they don't like, to help us. I mean, when we first get to the home, it is trial and error at first, because maybe you'll forget something like, oh, she doesn't like those pajamas, she prefers this, or that towel as opposed to the other color towel or something. So it is sometimes trial and error, but the best I can say is give us what the favorite foods are, what the favorite show, where the family photo album is that can bring back a pleasant memory. All Anything that could trigger anything that we can use for de-escalation.
When my mother-in-law, who has passed on since, had Alzheimer's, one of her obsessions was, and it would develop behavioral problems, was knowing that things cost money, right?
Yeah.
Old school, save for that rainy day, always had money in her purse, but didn't want to let it go. And one of the things that we would have to explain to her, would tell her that the service was being provided by her insurance through Kaiser, for example, or through whatever healthcare insurance you might have. And she would say, "Oh, they sent them?" And we would say, "Yeah." And then she would accept the respite worker because she thought it was the hospital or that provider sending them. And it alleviated that stress of her thinking that she's paying for somebody to come and help her.
I guess it's those little white lies that we often talk about, right? That those ways, methods of redirecting the focus, the hyper focus of the either the care receiver or even the caregiver. Sometimes they're hesitant, right? Like, what does that entail if I ask somebody to come into my home? I know that when I was caring for my great aunt who had dementia, there was a point that I decided I need somebody to help with her just day-to-day needs, right? Cooking and cleaning and putting things away so she wouldn't trip. And it was difficult. I could not convince my aunt that this person was there to help her because she wasn't doing the things that she needed to do. And this is before I even realized that it was dementia. I had to tell her, this lady is coming in to help clean the house, and this is what she's going to help you wash the dishes and cook. And she was like, oh, okay. But it wasn't because she's the one that needed care. I just
Right.
had to frame it differently. And I think those are the tricks that caregivers often have to utilize to get the person to acquiesce to getting somebody to help them. So I wanted to ask you, Junie, what are some ways that your team works with the family caregiver so that they have a better and easier transition when hiring people into the home?
So after we gather the information from your team and from the family caregiver. We then, we give that information to our client care coordinators who are out in the field. They introduce the caregiver to the family, make sure it's a good fit, and they're always in the field in case the caregiver needs a little help with a de-escalation. If the caregiver, I mean, sometimes you can run out of ideas also when you have somebody who doesn't want to get out of bed or have their undergarments changed, maybe they're wet and they've tried. And so we will have somebody, a client care coordinator, give ideas, maybe back off a little bit, redirect whatever we can do. And, or maybe they go and help. Maybe, maybe they're just not, as I put it, vibing with that person right then and there, and they can go help. Maybe somebody new, maybe they need a different face. Every situation is different. And until they get to know that person and see that person, it just every situation, every house is different.
I appreciate you saying that, Junie, because I know that's the case with caregivers, right? There's always that desire to make sure that whoever's coming into their home is really taking care of their loved one, but also their home. It's their home, right? And it's their environment. So to be able to have someone, or your flexibility that says maybe this person is not vibing, we need to get another person, maybe the other person has a different way of handling this situation, that's very comforting. I know that as a caregiver, to hear you say that, it's very comforting to know that there is that patience and flexibility, especially in these situations that are so difficult and challenging.
So even the caregiver or the respite professional caregiver, sometimes it's just good just to take a step back and get another idea. It just depends upon the level of dementia. We're trained. We constantly are in training, trying to, absorb new ideas. I watch your videos. We watch a lot of different information, and we try to ourselves, along with our caregivers, try to learn that.
Yeah, Junie, thank you for talking about training, because I think that's one of the really important key components when setting in respite professionals to help give a break to a family caregiver, them understanding that Alzheimer's or the dementia that is causing these symptoms of behavioral problems, paranoia, confusion, and sometimes that individual could also be accusatory. You stole my chocolate bar, or you took this from my kitchen. I'm missing my favorite, spoon. And for the trainings to teach the care professionals, the respite providers, that it don't take it personal. It's the
Exactly.
symptoms of dementia, and learn how to redirect, as you had been mentioning, and know on the spot that you can redirect and change the whole intensity of that situation very quickly sometimes. I remember a story of an older gentleman who was caregiving for his wife, and she was a handful for him because she didn't like him around her all the time. And he was, of course, you know, there following her around, making sure she didn't fall. But I think that annoyed her at the same time. They were married for like 50 plus years. And I remember the respite worker saying that when she would go there, he would make sure that she knew where everything was. The respite worker knew everything was, and then he'd say, "Okay, I'll be back in a little while." And as soon as he would leave the house, the care recipient, or the his wife, who had Alzheimer's, would say, "I thought he would never leave." And then she goes, "Let's get ready and go to that dance." So in her mind, she was trying to get out of this house to go to a dance. So the respite worker they would go up to her closet and they would go look at all these old dresses, and why don't we try on this one, and why don't we try? So they'd spend about an hour or so looking at the different dresses and then telling stories about the dresses. And it was just it became a fun activity to do. But it was really nice. So training the professional respite provider or worker about dementia, Alzheimer's, and how to utilize that time to make it a fun activity could be a great experience for the individual who's there always with the family caregiver, you know? It gives them a break from that person as well sometimes.
I find that music from their time period, so the music, the photographs, I like the idea of trying on the dresses. Sometimes, if they have a curio cabinet, you're able to ask them about memories in that curio cabinet. It's making those connections so that way you lower that anxiety. They're talking about good memories. Why would you pick up a little Hummel doll and put it in your curio unless it was a good memory? And so those are the connections that the caregivers, or as professional respite worker, it's making those connections that helps them lower that anxiety, and just makes and then they come back with good stories with us also. Oh, I found what, makes them happy. They like this music, or like they like this photo album, and I sat there with them and we looked at old memories, or I looked at their curio cabinet, or as you said, they looked at old dresses. And so those are the connections we're trying to make, so that way they're happy. The caregiver feels that they can leave the home and get the care they need, or whatever it is they're doing for their family or for themselves.
And it's really that personal touch, that personal connection, especially with someone who has memory loss. It becomes such a valuable, such a key point, to just take the time to say, oh, she liked dancing. Let's reframe what's happening around dancing, or looking at, some old memories. That's what it takes for someone to, I think, have a better experience with the care receiver in this case, because instead of trying to fight with them to understand what's happening, we're really assimilating to their what they are experiencing, becoming part of that perspective. So I think that's really important for everyone who works with care receivers, in this case people with dementia, to take into consideration.
And that's why it's so important with our initial call to get the information from the caregiver. What do they like? What are things that will bring us into the home easier? Is it a favorite cake? Is it a favorite what is it that will allow us to be in there with the least amount of resistance?
Yeah, I appreciate both of you talking about, the different redirecting and making just a wonderful experience within the home. I know that respite continues to be one of the most important components of a well-rounded comprehensive care plan, because you can list a number of things that are important that should be a priority for the family and the caregiver, the family caregiver. And sometimes they can't get to those without that respite. Without that, they can't, even if they leave, they don't have that emotional fortitude to get out of the home because they're so overwhelmed and worried at the same time when they're gone. So having a great respite program part of your care plan is really important. Well, that's all the time we have left for this edition of Let's Talk Caregiving. To hear more podcasts, follow us on your favorite podcasting platforms or visit our website at scrc.care. I want to thank Martha for co-hosting another important discussion, Junie Baratti for joining us today, and our audience for tuning in. If you're providing support to a loved one, you don't have to do this alone. Asking for help is not a sign of weakness, it's a sign of strength. To connect to our programs and services, visit our website at scrc.care or call us at 1-800-827-1008. If you live outside of San Diego and Imperial counties, visit caregivercalifornia.org. To support our efforts and make a tax-deductible donation, please go to scrc.care and click on the Donate tab. And remember, SCRC is here for you, caring for those who care for others.